السلام عليكم طلاب المرحلة الثالثة كلية الطب جامعة نيسان. معكم دكتور حيدر سعدون قاسم, consultant physician. Our lecture today about malaria. So, insect and disease. We have tsetse fly and we have rodivid bugs. We have black fly and we have mosquito, which is responsible for malaria. And usually it is female, Anopheles mosquito. The term malaria is originated from an old Italian word which means bad air. The disease was formerly called marsh fever. Why? Because it's associated with the swamps and marsh island. Usually at that time it affects soldiers and Second World War. This is malarial zone. So it is disease primarily affect the African and South American population. Here the incidence per 100,000 of population of malaria. Number one is Guinea, followed by other African countries. Epidemiology about 200 million cases of malaria. 2012 WHO last report estimated about 600,000 deaths. Malaria mortality rate have still keep its rate about 42% globally since 2000 and about 50 in the WHO African region registration. Most deaths occur among children who live in Africa, and malarial mortality in African child may reach up to 54 since 2000. This is the registration. Mosquito morphology. This is the morphology of mosquito. This is the adult head and mouth, and this is the anatomy. Types of malaria: we have falciparum, ovale, malari, vivax, and plasmodium knowlesi. Knowlesi, it is affect mainly monkey. Falciparum, it is major one, affect most of the population of South Africa. In addition to malaria, it is more fatal one. Ovale and vivax, they are both type or species present in Iraq. This is the life cycle. This is the insect of mosquito. This is the sporozoid. Sporozoid goes to the liver. Some of them still in the liver, dormant, hepatic schizont. Some of them rupture to the circulation, blood circulation of the patient. Merozoid, and these merozoid affect RBC, causing their hemolysis, and this can be diagnosed by blood film, blood stage, schizont. And then the blood contain gametocyte, which can be transmitted again to the Anopheles female mosquito. This is Plasmodium falciparum. Why we call them falciparum? It looks like falciparum, مثل المنجل بالعربي. Falciparum blood stage. This is an affected person, 4 hour, 2 hour, 12 hour, schizont. And this is a nice picture. Red blood cell burst after infection with malaria. This is malaria affecting the retinal vessels and causes cerebral malaria. And this is mosquito breeding sites. مكانات اللي تتكاثر بها هي المستنقعات, كتلة الأماكن المياه الآسنة. Plasmodium falciparum. This is ring stage. تشبه الحلقة, محبس براس حلقة. Clue to species diagnosis: falciparum, vivax, ovale, and malaria. Each of these having a different shape and character, and this is obvious by this diagram. Malaria blood stage. This is female and male gametocyte. This is schizonts, and this is trophozoid. Nice handwriting. Clinical malaria. Incubation period from 1 week to 4 weeks, 7 to 30 days. Anti-malarial drugs taken for prophylaxis may prolong. يعني واحد رايح المنطقة endemic with malaria ياخذ prophylaxis antibiotics, ممكن تظهر عدة الأعراض ولكن أكثر من 30 يوم. زين. Uncomplicated malaria: adult fever, cold stage, hot stage, sweating stage, flu-like symptom, anemia, organomegaly, diarrhea, and even vomiting. Malaria relapse months to years later. As I mentioned, it can be dormant in the liver for years. These are the systems affected by malaria. Start from neurological, optic, respiratory, cardio, renal, abdomen, all systems affected by malaria. But the commonest is blood and hepatosplenomegaly, and followed by central nervous system and renal. This is the temperature chart. Day 1, high fever. Day 2, normal. Day 3, high fever. Day 4, normal. Day 5, high fever. So this is a characteristic temperature chart for patient with malaria. This is organomegaly, patient affected with malaria. All these not arrow for splenomegaly. Transmission: female Anopheles mosquito carries parasite, transmit to the human, affect RBC, not highly contagious, however affect blood cells, and can pass through a placenta to the vertical transmission from the mother to the fetus. What we mean by severe malaria, it means cerebral malaria, anemia, respiratory distress syndrome, placental malaria, and multi-organ failure. Cerebral malaria usually caused by falciparum, and it can be fatal in pediatric age group. 20% of those affected die, and usually seen in children above 2 years. Vivix and ovary persist in liver and dormant for years. So this is what we call latent malaria. The first attack may occur long after patient has left the endemic area, and the disease may relapse after treatment if a drug that kill only the erythrocytic stage of the parasite are given. So those patients who are traveling to endemic area may develop symptoms weeks or months after recovery or after returning from to their home. This is picture for cerebral malaria. Can be fatal. This is intracerebral hemorrhage. Anemia caused by malaria. What are the causes of anemia? Either distracted RBC due to invasion or distracted by the parasite itself, increased rate of removal abnormal RBC from the circulation by the spleen, suppressed erythropoiesis, bone marrow suppression, immune destruction of RBC coated with parasite, complement mediated, and usually occur early in life, less than 2 years, and from this we can call malaria black water fever. Why? Because of hemolysis, the patient urine become so dark because hemolyzed RBC and hemoglobin appear black in the urine. Diagnosis: thin and thick blood film. Thin and thick blood film. 6 from 8 slides negative exclude the diagnosis of malaria within 48 hours. So the diagnosis is very easy and cost effectiveness. So this is thick and this is thin blood film. Plasmodium blood smear according to the type: Vivix, falciparum, ovale, or malaria. Each one has its characteristic shape. Rapid diagnostic test, ELISA test, and flow cytometry or PCR. Usually these are not done unless for study purposes. Falciparum malaria is the most dangerous one because it makes RBC stick to veins and clot them. So it can cause clotting abnormalities, and even can cause DIC, disseminated intravascular coagulation. Prophylaxis: when you go to area in which there is no resistance to Plasmodium falciparum, chloroquine, phosphate, hydroxychloroquine, acetaminophen, hydroxychloroquine, or drug of choice with COVID-19, novel COVID-19 infection. Non-persistent or resistant Plasmodium falciparum, mefloquine, or doxycycline, or atovaquone, or broganil. These can be used for patients with or from area with resistance to chloroquine. Treatment: you should know the area of malarial zone affected. Important to know where malaria was picked up. From Africa, resistant to medicine. Malaria from South America is not. Primaquine, standard medicine for malaria of the liver. Chloroquine is the medicine of malaria in the blood. And use bug spray and mosquito net to avoid mosquito bite. Co-artimether contain artemether and lumefantrine lumefantrine. It's given as 4 tabs, 0 time, 8 hours, 24, 36, 48, and 60 hours. Doxycycline and artemether should be avoided in a pregnancy. Quinine, dose of quinine, and this is the dose of atovaquinone or Brognin. Pregnant women are more likely to develop severe type of malaria, especially falciparum malaria. Complications such as hypoglycemia and pulmonary edema are more common. Maternal mortality can be 50%. Artemether is the drug of choice over quinine in the second and third trimester, since quinine is associated with recurrent hypoglycemia, and still first trimester quinine is acceptable choice. What we mean by relapse, the emergence of new parasitemia. What we mean by recrudescence, recurrence of malarial illness is called recrudescence. It is caused by persistence of blood form in small number between attacks. What occur in natural infection? In malarial endemic area, children are infected early in life, remain parasitemic for years. Resistant to disease and to infection are acquired very slowly, with resistant to severe disease occurring first. Resistant is incomplete since in high endemic area adults frequently يعني من يصير عندك إصابة أو من يصير عنده إصابة البيشنت في endemic area, recurrent infection can be occur but usually mild than the previous one, and single infection do not give long life immunity. Pregnant women lost resistant to infection, especially first pregnancy. Malaria has different epidemiological characteristics depend on location. مثل ما قلنا بالأفريقيا تكون أكثر عدائية وأكثر خطورة من أمريكا الجنوبية. موسكيتو كنترول، سيارات ترش الدي دي تي وهاي الخيم، واكو ريبلنت مثل دهن يدهن به الشخص حتى ما تجي الموسكيتو. insecticide resistant, this is important issue. يعني الدول الأفريقية ترفض استخدام الدي دي تي، هاي الانسكتيسايد، تعتقد ان هاي المواد هي تعتبرها مواد مسرطنة، ممكن تأثر على البيئة مالتهم، ممكن تأثر على الغذاء مالتهم. تعرفون بيئتهم كلها يعني عبارة عن غابات استوائية، فيرفضون استخدام الدي دي تي، ولذلك ملاريا موجودة ولحد الآن في الدول الأفريقية. وهذا آخر شيء نختم المحاضرة، سايلنت سبرينج باي راشل كارسون. هذا تحبون تقروا الكتاب، يعني يحكي بالربيع الصامت على سبب زيادة نسبة السرطان بالعالم، هو اللي يعني يعتبر الاربنايزيشن وعافوا الغذاء الصحي يعني شلون نقول ترهوا بالمعامل والمواد الكيميائية والمواد الحافظة. كتاب حلو ممتع موجود منه باللغة العربية. شكرا جزيلا.